What's going on, everybody? Welcome into another episode of the Strength for Your Purpose podcast. This is the 75th episode of the Strength for Your Purpose podcast. Oh, that's right. And my recurring guest, is very excited. I think this is the third time you've been on the podcast, Dr. Andrea.
I think so. Yeah, I think so. Hi, everybody. Dr. Andrea Smith there.
Dr. Andrea Smith of Synaptic Chiropractic. Yeah, because came on for an initial interview talking about what you do over at Synaptic Chiropractic, and then we finished that interview, and Dr. Andrea goes, someone needs to come on here and interview you, and I want to do that. And I was like, let's do it. So here we are for the third go round here of Dr. Andrea here on the show. And Doc, thanks so much for joining me. I'm really excited to chat with you today.
Oh, thank you for having me. I know I'm excited too. I always love geeking out about all the stuff that's related to the body. So I'm pumped to do that with you today.
Yeah. And we've got some fun stuff. Our conversation when we decided to do this episode was about disc pain, disc herniation or disc bulging pain in the low back. And you just brought up something really interesting about some stuff you've been seeing and reading, seeing in some of your clientele, reading in some research about the connections between stress, specifically stress about money, and it manifesting as some back pain. So maybe let's kind of start there. Like, what have you been, what kind of trends have you been seeing, and what sort of prompted you to sort of look down that rabbit hole a little bit, so to speak, about the money stress connections and back pain?
Yeah. Well, I mean, my practice is primarily a stress-based practice. Well, not where I stress my patients out, but where we help them learn how to better adapt to their stress. So I'm always interested when I see certain trends starting to happen in my practice. I always like to check in and see, like, where does that correlate? Like, are there studies out there that I can check into? I love to educate myself further, because that only benefits my patients more. And I know you're the same way too. Like, you're always reading, always gathering information. And what's been coming up a lot that I've been seeing over the last, few months, probably 2 months, 2.5 months, is a lot more increased what we call a hot low back or low back pain related to what people are calling, they get the sciatica, the pinched nerve, the burning sensation across the lower back, the inability to stand up straight after trying to tie their shoes. And I was like, it comes and goes, it ebbs and flows, but right now it's pretty consistently, that's what I'm seeing a lot of. So in the research that I was doing, things were coming up out of like some articles in Psychology Today, some different NIH studies, things like that, related to the stress of money and how it presents in the musculoskeletal system. And specifically, there was really, really focused on money. And as we all know, things have been a little crazy. I probably don't need to point that out to anybody. Interest rates are crazy. Gas prices are insane. Everything's no, I mean, yeah, it's great, right? I know you commute a lot. I commute quite a bit too. It's an interesting process at the gas pump right now. Where you're like, ooh, I found it for $4.89. I feel like a winner today.
Buy a lottery ticket.
I know. So just seeing all that stuff come up, and then realizing that there's a correlation, and it's a scientific or it's a biological correlation where, and you can jump in and definitely please interrupt me, but we have the hypothalamus pituitary adrenal complex. So that's what's been coming up in the studies I've been reading. That's what I've studied a long time about. So you have the hypothalamus, the part of the brain that releases a hormone called CRH. CRH stimulates the pituitary gland, which then in turn stimulates the adrenal glands. So a lot of people have heard about their adrenal glands, like adrenal fatigue, all sorts of things. This is a great process. So, get the hypothalamus going, get the pituitary going, get the adrenal glands going, then it releases cortisol. And cortisol in its doses, when it's supposed to do, is an awesome hormone because it gets into the system. It uses the glucose during a stress response to create and work through energy, use energy. So we have that energy to get through that stress response. But when we don't have that negative feedback loop turning off that stimulation, we're constantly releasing cortisol into our systems, which, as you know, creates our lovely inflammation.
Right.
So then when we have that inflammation and we have areas that are already compromised that we may not have even known, because as you know, the study, the laid back study, you can have disc bulges, you can have herniations, you can have other things going on that you never know about until all the circumstances are right. And that's where inflammation comes in. So
yeah, no, I love that. And I think in general these days, we all, even if we remove some of the financial stressors, I think because of our devices and social media, our levels of cortisol are probably higher in the body to begin with. I work with a lot of corporate America type folks. They're always very stressed every time I talk to them. Always have a lot going on. And even if they don't seem very stressed, they're coming into the appointment, doing something on the phone or the laptop related to work. They're doing the appointment. And then when they're leaving, they're already starting to do the same thing. So they might not physically show it, or what they're feeling might not be an obvious physical manifestation of that stress. But I think in general, that those levels are already up for us. And there is a significant connection between areas in our brain that perceive pain and some of those emotional centers, those stress centers. They're not that far away from each other. They're very and they're very interactive, right? They talk 100%. They talk a lot. So, you know, like you said, that the laid back study, you can have any structure in your back could be something that's sort of an underlying thing going on for you, and you have no pain whatsoever. In fact, somewhere between half and 2/3 of people, depending on the age group you look at, have all of those things going on: degeneration, disc bulging, arthritis, stenosis, whatever the case might be, with no pain at all. And yeah, whether it's a physical manifestation of stress, of a stress response that peaks that pain up, maybe that is also combined with a big shift in the stressors being placed on that area of the body physically that has imbalances going on already that make that more noticeable. So all of a sudden that area that has that thing going on has more stress, physical stress placed on it, not just emotional stress. And then we add the emotional stress to it. This thing can snowball.
100%. And, you know, as you said, you working with like corporate type people, they're usually, a lot of the times they're working from a desk, they're working from a computer, they're in that sort of what we call those, you know, those chronic stress positions for long periods of time. So it's not, when we talk about repetitive stress, a lot of people think like manual labor, like they're like, oh, you're pounding a hammer for a long period of time, you're cranking a wrench, you're pushing something, you're pulling something. But repetitive stress is also going to work and doing the same thing for 8 hours a day and it's not changing. So when you combine, like you said, with that physical stress of either sitting or doing whatever you're doing day after day, combining that again with that stressor, then you create emotional stress, and then you have chemical stress from the foods that you eat, the things you ingest into your body, and you get that trifecta. Then you have this like sort of beautiful little cosm of stress that goes into your system, and then something's usually bound to present itself finally, where you might have had that disc bulge for years, you never would have known about it, but that perfect storm came in and allowed it to express itself.
For sure. And you know, I find the people that actually tend to have more of the static stress on their body, even in the more labor intensive jobs. So for example, the person that works on the job site but is driving the bigger piece of equipment all day. You know, periodically they're climbing up and down the equipment. They might have to go lift and move heavy things, but for a majority of their day, they're just sitting in a seat that's vibrating with a lot of force up through their back. And then you look at the people that are at a computer all day long. Those people are the ones that tend to actually develop more of the physical imbalances that when life then asks them to move outside of that pattern they're used to being in, that's when that increase in physical stress happens. So it's interesting. And I'll be interested to hear your take on this again, because your practice is so focused on helping people handle that stress in their in their body and in their nervous system. Sometimes in these situations, I think the physical manifestation, and it can go both ways. I think this is just depends on what you're looking for, and I guess what you're asking the
Yeah.
client as well. Your line of questioning could certainly matter here.
Yeah.
But I think oftentimes there'll be like a little tweak of something that's maybe more physical in
Mm-hmm.
nature. They put that physical stress on that area that
Yep.
causes that disc bulge to finally hit the nerve that sends the pain down the leg.
Yeah.
And then immediately following that emotional stuff kicks in
Oh yeah.
and sends it to the next level. So I in my experience, that's usually what I see with people that have a high stress response
Yep.
coupled with that like low back or sciatica type pain. Is there was something physical that kicked it off. Now the stress might have, we could play the chicken or the egg game here, Doc. And
Yeah.
the stress, the emotional stress might have led to the physical stress that caused the pain that then got worse with more
Yep.
emotional stress. But that's typically the pattern that I see.
I would agree, definitely, to an extent. I would definitely agree that, it just takes that. And people, it's always, I don't know, not always, but I would say a lot of the times for me, when I hear people come, they're like, but all I did was bend down to tie my shoe.
Yeah.
All I did was reach over to grab something, and it went. And it's like, but what happened the days, weeks, and months before that? Like, what changed? And those are the line of questioning I go down. It's like, yes, that happened. That did not cause your bulge. So let's talk about what's happened the weeks, the months before. And that's when you start delving into more. And that's why taking an important history is so important.
Yeah.
When it comes to the kind of care that we do with people. So when people are like, oh, well, I had a back surgery, but that was years ago, so it doesn't matter. It's like, no, it still matters. Like, I still want to know. So taking those histories is so important, and listening and like listening to the patient, looking at them and listening, I think is so important as well. But yeah, I would agree that the stress response in the body is usually, there is a slight physical either accident or incident that happens that kicks it off, and then the emotional stress part comes into it.
For sure.
And then that cycles in, and it gets worse and worse and worse until you see one of us, and we and we help. It's that loop. It's that feedback loop. It's like, we need to break into that pain cycle, break into that cycle to open it up and make it a line again, so it's not a circle, so it can keep flowing away.
Exactly. Yeah. Break you out of the vicious cycle. And kind of a nerd moment here. I'd be really interesting to hear if in any of your studies, especially if they were, because we sort of started on this conversation talking about disc type stuff. So and what made me think of this is what you said. Alls I did was bend over to tie my shoe, or I picked up a pencil or whatever. And it makes people think that their backs are weak. When actually our backs are probably our strongest anatomical structure in the entire body, as a unit. And it's not weak. It's just that undue stress was placed on that one area due to these imbalances that are going on. And I kind of wonder if in any of the things you looked at with those higher levels of cortisol in the body, I wonder if that has an effect to the thick outer layer of the discs wearing away a little faster. I mean, this is just a question that's popped up that I don't know if you know the answer or not, but it's just kind of a thing that popped up to me, because that tough outer layer of the disc can be susceptible, especially as we go through the aging process, to just wearing down from a natural aging process. It doesn't get as much water and hydration. That tough tissue that doesn't have its own blood supply gets a little more brittle. And I'd have to imagine, in a situation like you're describing, with those high levels of cortisol coursing through our body all the time, might have an effect on changing the integrity of that tissue and wearing it down a little faster.
Well, and that's exactly one of the studies I read. They talked a lot about how back in the day, in the 60s, 70s, 80s, even into the 90s, they weren't sure if increased hormone response, be it cortisol, norepinephrine, like any of these stress hormones that get released, they weren't sure if that had any sort of effect on the structural integrity. So like bone development and everything like that. We now know through all the studies that have come out that yes, an increased stress response, increased cortisol, any feedback loop that isn't shutting off the way that it should when it's fed is going to have an effect on the structural integrity of your bone health. So, we get into osteoporosis, osteopenia, all those other things. So the actual vertebrae, and then that soft, wonderful disc that we need as a shock absorber. With yes, with aging, it starts to change, but having somebody who's under chronic stress, and when we say stress, we don't always mean emotional stress. We mean physical stress, chemical stress, and emotional stress.
Sure.
So if any of those stressors are increased for an extended period of time, it will have to have an effect on the soft tissue portions of the body. So ligament instabilities, all that good stuff that we know contributes into spinal health. So definitely.
Yeah. Fantastic. So we have these physical stressors that we can have a positive effect on either before or after pain is taking place. We have these emotional stressors, and chemical stressors. All of these things we can have an effect on whether pain is present or not, if we're speaking from a prevention model. So what do we do? What I bent over, I picked up the pencil, my back now hurts. I've got
what do I do?
What now, Dr. Andrea? What now?
Well, just stop stressing, right? That's sarcasm for anybody that's not actually watching my face right now. Because it's terrible when somebody tells you stop stressing.
Just calm down.
Just stop it. Yeah. Oh, calm down's the favorite one. Because we can't eliminate stress from our lives. I mean, yes, there's some things we can probably take out that we don't need to be dealing with, but and that's our personal stuff. But we can't avoid stress, but what we can do is learn how to work within it and adapt to it, so that when we have that sympathetic response, that fight or flight response, which we should have in certain circumstances, it's a healthy response to have.
You need it. Yeah.
You need it to live. You need it to survive. But what you don't need it is all the time. Right. So we need to learn how to turn that off. And as far as where I come in, and you can jump right in here, or where you come in is more of that physical, sometimes emotional response to that pain response. So with chiropractic, we work on adjusting the spine. We work on relaxing the system, getting the breath into the body again, because, when that stress response comes in, our breathing goes, our respiration rate goes up, our heart rate goes up, our blood pressure goes great. All these things go up, and we work in chiropractic on bringing everything back down more into a parasympathetic response, because if you're not in that fight or flight situation anymore, you don't need to be in that fight or flight response anymore.
Right.
So let's bring you back in by doing adjustments to the spine. And by doing that, we're creating mobilization within the joint, within the tissue, to help bring in that nice fresh fluid for the discs that are dehydrated and need a little extra help. Yeah. Create some movement. And then there's your part where and that's why we do cross referrals with people. People think PTs and chiros don't do cross referrals, but we do it all the time, because they're things that Dr. Phil is incredible at, and creating more movement and strength and supporting those structures. And where I come in is, decreasing the tension within the spine, allowing the nervous system to start working at its optimal functioning level again.
Yeah. So. Yeah, no, Dr. Andrea gets them there, and I like to help keep them there. That's the way I like to look at it.
I love that.
We get things just moving better and talking better, but then we need to the nervous system and the way it talks to our muscles is a lot like strengthening the muscle itself, right? In order to, if I want my bicep to be stronger, I need to be moving a certain amount of weight for a certain amount of reps, a certain amount of times per week, and progressively increase that resistance over time. Same thing with our nervous system. If it's been out of whack and not communicating well for a while, once we get those communication channels working better, we then need to strengthen them. We then need to say, when our body does this kind of movement, you need to be talking to these muscles, not just these muscles. We need to be, a little more well-rounded. So, strengthening those communication channels from a neurological perspective and from a actual strength perspective is really where my part comes into that. And just taking that a step further from a stress response, we know that movement in general, even as little as 20 to 30 minutes of walking at your normal, like the pace you would walk around the grocery store,
Yep.
Doing that for 20, 30 minutes, maybe not in the grocery store, especially if you're bringing kids with you. That's a stressful.
Yes.
The pace of a grocery store is what I'm getting at here. But just that little bit of walking can decrease those stress hormones in our body, just that little bit of movement. So if we take that even to a higher degree and are doing more strength and stability training with these newfound communication channels that we've improved upon, while decreasing those stress hormones, we're hitting all three areas of this stress response to that area of the body in a very well-rounded fashion. And by doing so progressively over time works really well at keeping that area from re-injuring itself.
100%. I mean, there's the saying, and everybody's heard it, and most people have said it, but if you don't move it, you lose it. So if the more you move in a way that is like honoring to your body, and I always tell people, find the exercise or the program or the thing that you do that you actually like doing. Like if you hate walking, if you hate it, you're going to do it for a couple of days. You're going to stop doing it. And then you're not going to do it anymore. But if you find a yoga class, or if you find a video on YouTube that you love, or if you talk to Dr. Phil and he's able to give you some like incredible exercises and things that you can do, it create a routine for you at home to increase mobility, and you love that routine that he's given you, then do that. Don't try and do something you don't like to do, because you will definitely stop doing it.
You got it. Motion is lotion, and you got
motion is lotion.
You got to like the motion to get the lotion. So
100%, 100%.
Yeah.
So just keep moving, keep your hydration levels up, support the body, and, understanding that stress isn't necessarily a bad thing, but chronic stress is an unhelpful thing to your body. It's not gonna serve you in any way. So if you feel like you're in that chronic stress situation, checking in with Phil or myself or any of your other healthcare practitioners, just to make sure that you're getting the tools that you need to deal with that and handle that properly.
Yeah, 100%. And the great part about that is, here in our wonderful state of Maine, is you can reach out directly to people like Dr. Andrea and myself directly, without having to go through other channels to get sent over to us through other medical providers. Obviously, if you prefer to see an MD before you see anyone else, I'm not telling you not to do that. If you feel like you have to go see your medical doctor, by all means, but you don't absolutely need to go see a more specialty practitioner to start working on these types of things. And we're able to get conservative treatment going. Actually, one quick thing, while we're on that topic, I saw a really interesting study specifically about surgery for disc pain, disc bulges in the spine, and its results long term. Well, and by long term, I mean 12. I think they probably only went out to 12 weeks, if I remember correctly.
Yeah.
So quote unquote long term versus conservative treatment. And what they found was that at the 6-week mark, the patients who had surgery did have less pain and slightly more function compared to the people that just did conservative treatment.
At the 6-week mark.
At the 6-week mark. At 12 weeks, it didn't matter.
Yep.
Now, the people that did conservative treatment got better in the 6 weeks. They just didn't get as better as the people that had gone under the knife.
Yeah.
But at 12 weeks, it no longer mattered. So if at the end it's not going to matter and your improvements are going to look the same, yes, we want to get better faster, but oftentimes what I see is the people that go and have the surgery don't get any of the follow-up of this physical and emotional stress. The only physical stress they got addressed was that one piece of disc pushing on that nerve, but they don't go in there and make sure that disc never bulges again. And that's what people don't understand. So unless we're addressing all of those other physical imbalances and that mental emotional imbalance and the chemical imbalance going on there, this is going to happen again. And it might happen a lot faster than you think. So
if the environment doesn't change when you go back into the environment, it's going to have the same results. It can't do anything but. So and there's been a couple of patients in my career that surgery was probably required and needed, and they got that, and it helped, but they also knew that after that surgery, they needed to, one, do their PT regimen religiously. And that just doesn't mean like the 12 weeks or the 6 weeks that you have, diet or recommended by the surgeon. This is a lifetime now. Like this is, and it makes it sound like so work and so daunting, but it's not, because it's your body. This is the only thing you get to live in. So why not treat it as good as you can? And and if you need help and guidance in doing that, like Dr. Phil and myself can definitely help you do that for sure. We'd love doing that.
Love doing that. It's my favorite. It's my favorite thing. Awesome. Well, this is such a fantastic conversation, Dr. Andrea. Thanks so much for this. There were probably 3 or 4 other topics that popped up as we got talking here that we could do. So, if we want to just like meet once a month on here and do a podcast, I think we could probably do that. I think you and I could talk till the cows come home. So it'd be totally fine. And I don't know about you, but I don't own any cows. So we'll be
perfect.
We'll be on here for a while. Well, thank you so much again. Tell everybody real quick, what are the easiest ways for them to find you and to learn more about Synaptic Chiropractic?
Okay. Yep. We're Synaptic Chiropractic. We're located in Westbrook, Maine. Our phone number is 207-591-0384. Our website is synapticdc.com, and you can find a lot of information on there. And if you want to give the office a call, Katie, my amazing office coordinator, can answer any questions you have. And if you have questions directly for me, just give the office a call. I love getting on the phone with patients. So people feel nervous to call their doctor. Like, nobody wants to get on the phone with them. I love it. Like, call me, ask me questions. I love
me too.
It.
Yeah, me too. I spent 20 minutes on the phone on the ride home tonight talking to someone new who was inquiring about something for their hip, and I was like, 25 minutes felt like nothing. It was I loved every minute of it. Yeah,
I know. I call it I like to geek out on my profession. So it's awesome.
Love to show people the power of what we can.
How can people find you, Phil, besides here?
Well, great question. Great question, Doc. You can find me on all social media pages, and for everyone listening, all of Dr. Andrea's contact info and mine as well will be in the show notes, so you can find that pretty easily as well. But if you search at WorkFitMe on any social media platform, you can find us there, workfitme.com. All of our contact information is there. WorkFitMe mobilept@gmail.com is another great way to get a hold of us. And there's contact info in the show notes for Dr. Andrea and Synaptic Chiropractic and myself as well. So awesome. Dr. Andrea, thank you so much again. This was a fantastic conversation. Of course, anytime. And for everyone out there listening, thank you for 75 episodes. This is awesome. It's incredible. Can't believe that we're pushing that far into it, but I'm so happy for you all to be listening. If you found value in this episode, please be a friend and tell a friend, share it with someone you know, love, and care about who could use this information to help them live a happier, healthier, and wealthier life. And go make it an incredible week. We'll see you all back here next time on the Strength for Your Purpose podcast. Bye.
Awesome. Bye, everybody.